Well, today is the culmination of what has been going on for the last 10 days or so, where many residents in lower risk areas were given passes that allowed them to leave their homes for a few hours a day. From today, they can actually circulate freely throughout the city. Public transport is working once again. And also many companies, particularly state-run companies, are demanding that their staff return to their offices. COVID cases have been reduced to a trickle. There was only 14 yesterday in Shanghai. So the Chinese government themselves would say that the lockdown has worked, but it has been very punishing for many residents of Shanghai. Lockdowns elsewhere in the world were also rather grueling, but really Shanghai is on a different level. People were forbidden from leaving their apartments for anything except for COVID testing, which happened generally every 3 to 4 days throughout the lockdown, and many were not able to even access food because food supplies more or less collapsed at the height of the lockdown. And there was quite a lot of despair articulated on social media, and there were even a few reported suicides as a result of it. So Shanghai people will be quite happy that this particular experience is over, but of course there does remain the possibility that, just like elsewhere in the world, lockdowns could come back.
And Oliver, just what's happening there today? Is it an indication that Beijing may be rethinking its zero COVID policy?
There looks to be very little sign of that, even though the World Health Organization has said China's zero COVID policy is unsustainable. Xi Jinping himself said just a few weeks ago that the Shanghai lockdown would stand the test of time, and he also warned officials not to question the zero COVID policy. There are a number of reasons why the Chinese government wants to maintain it. One is the continued sluggish vaccination rate among China's elderly. For instance, Chinese people over the age of 80, only just over half are vaccinated with 2 shots, and only 20% have a booster. And a booster with China's Sinovac vaccine is pretty much considered the minimum necessary to battle against Omicron. A second issue is ICU capacity. An article in the British science journal Nature recently estimated that if there was an outbreak, China's ICU capacity would probably be exceeded 15 times. And it also modelled, in a worst-case scenario, a potential deaths of 1.5 million people. Now, of course, that is a worst-case scenario, but it's something that the Chinese government is bearing in mind. And it must also be said that for the Chinese government, it is also political. It has staked so much on its relative success over the last 2.5 years in containing the initial outbreak of COVID, and it is the policy continues to be quite popular. Certainly not with people like Shanghai or other locked down cities like Xi'an in recent months. But an awful lot of that anger that was articulated on social media was actually highly censored, and certainly Chinese state media, particularly TV and the press, are not covering it. So elsewhere in the country, zero COVID remains relatively popular, and with Xi Jinping hoping to get a third term at the Chinese Communist Party conference later this year in October, he certainly does not want any large outbreak before then. So for at least this year anyway, China's zero COVID policy looks to be remaining in place.
OK, we'll leave it there, Oliver. That's our correspondent.